My name is Ibrahim, and I will be talking about the most commonly painkiller sold purchased in the market. And we all know that after paracetamol, ibuprofen is the most commonly painkiller. But people have been taking this ibuprofen without even paying attention to the side effect or adverse effect. And the adverse effect of ibuprofen and is more greater than the paracetamol. Now, let's look at before we proceed to the uses and the adverse effect of ibuprofen. But let us know about ibuprofen. Now we have ibuprofen, which is generic name is ibuprofen. We have brand name. The brand name of ibuprofen, the company that being that ibuprofen have been produced. We have the Brustal, we have Brufen, we have Ibucap, we have Nurofen. Now we have what are the classification of ibuprofen? Is classification we have therapeutic class, we have the pharmacology class, and the therapeutic class is used as what analgesic, which is to reduce pain, and the antipyretic to reduce fever or high body temperature, and also anti-inflammatory, which is to reduce what inflammation in our body. And what are the pharmacological class of ibuprofen? The ibuprofen belong to NSAID classification, which is non-steroidal anti-inflammatory drug. And we have various dosage form of ibuprofen which has been produced. We have it in tablet, we have in the capsule, we have in its oral suspension, we have it in syrup. Also have it in chewable tablet and also topical gel, which is rubbed in our external part of our body. And we also have strength. What are the strength of ibuprofen? We have tablet, which is 200 milligram. We have it in 200 milligram. We also have it in 400 milligram. We also have it in 600 milligram. We also have it in 800 milligram. And what about the strength of syrup? We have it in 100 milligram per 5 ml. We also have it 200 milligram per 5 ml. And the topical gel, we also have in 5% in 100%. That is 5 gram in what 100 ml of 100 ml solution. And we also have injection of ibuprofen. We have it, the strength is 10 milligram per 2 ml, which is 1 ampoule. And we have it in 400 milligram per 4 ml. And we also have it in 800 milligram per 8 ml. And we also have it 800 milligram per 200 ml, which is RTU bag. Now, what are the pharmacokinetic of ibuprofen? And we all know that pharmacokinetic is what our body does to the drug. And what does our body does to ibuprofen? It is rapidly absorbed from the GIT. That means our body quickly absorb ibuprofen in our gastrointestinal. Now, what are the metabolism of ibuprofen? Now, ibuprofen is metabolized in our liver, which via what CYP enzyme. This enzyme that metabolize what ibuprofen. And how does our body eliminate ibuprofen? Our body eliminates ibuprofen through renal excretion. Can you imagine if somebody is having a complication in his renal, that means kidney? What do you think it will happen to the person? Because there will be more accumulation of ibuprofen in the renal, since the person cannot excrete ibuprofen, and ibuprofen is excreted in the renal. That means there will be complicated cases. Now, what are the mechanism of action? What are the actions that take place in our body when we administer ibuprofen? Now, ibuprofen work by reversible blocking cyclooxygenase enzymes, and which is cause 1 and cause 2, leading to reduced synthesis of prostaglandin, which are responsible for pain and inflammation and fever. Now, ibuprofen it have like three main effects. It's used as pain, inflammation, and fever. That means it have more effects than paracetamol. Now, what are the maximum daily dose of ibuprofen? We have the maximum daily dose of ibuprofen is 1,200 milligram per daily, and most of these youth of nowadays have been using ibuprofen more than the maximum daily dose, and which has caused many complicated issue in our body. And how can we take ibuprofen? How to take what ibuprofen? Number one, before you take ibuprofen, you need to take it what after meal or with milk, because ibuprofen, there is susceptibility that ibuprofen can cause bleeding, increase in bleeding in our GIT. Imagine when you do not take meal, you do not take ibuprofen after meal. Do you think you are susceptibility to what, to the bleeding? And also what, avoid taking on empty stomach. Now, why did I say that ibuprofen should be taken after meal? Is because it has for susceptibility of increasing in what, bleeding, and also it can cause what, ulcer, and that is why you should avoid it on taking it on empty stomach. And you should what, before you take ibuprofen, you should maintain adequate hydration. You should take a lot of water, because many people have been taking drugs, chewing it. Even some people will soak it in their morsel of food, like inside their food they soak it and they will eat it like that. It's not proper for ibuprofen. Before we take ibuprofen, we should administer it with enough water. Now, what are the uses of ibuprofen? It's used as mild to moderate pain. It's also used as anti-inflammation. It's also used as dysmenorrhea, that means painful in menstruation. And it's also used as rheumatoid arthritis, that means inflammation of the joint. And also used as osteoarthritis, that means inflammation which is due to the degeneration of cartilage. And also used as fever, that means to decrease the body temperature. And so what are the side effects of ibuprofen? And the side effects, they are the most commonly side effect. We have dyspepsia, that means stomach pain that is due to the indigestion. Is the percentage according to pharmacovigilance is 10 to 20%, and nausea is about 5 to 10%, while one of the side effects is headache and also dizziness. And what are the adverse effects? That means when you use it more than the normal dose, more than the required dose being prescribed by a pharmacist or doctors. What are the adverse effects it can cause? It can cause gastrointestinal bleeding. That means it can cause this high risk of causing what, bleeding when you use it more than the normal dose. Now, what are we also have peptic ulceration. It can also lead to what? Also cause ulcer, because once it causes ulcer, it's going to degenerate the stomach lining of your stomach and thereby causing what? Ulcer. And can also cause one of the adverse effects, also acute kidney injury. And we also have increase in cardiovascular risk. A lot of ibuprofen, a lot of researchers have done research on it that ibuprofen has caused a lot of cardiovascular risk. And what are the drugs that can be used with ibuprofen? We have a lot of drugs that can be used with ibuprofen that are safe. We have paracetamol, which is the first line of painkiller. And we also have anti-malaria drugs like artemether, lumefantrine, artesunate. They are mostly combined with anti-malaria. Ibuprofen are mostly combined with anti-malaria drugs. And we also have antibiotics like amoxicillin, azithromycin, and ciprofloxacin. And we also have antihistamine drug, which is drug used for allergy. And we have loratadine, cetirizine. They are safe with ibuprofen. And we also have proton pump inhibitor. This is ulcer drug. We have omeprazole, pantoprazole. They are mostly prescribed with ibuprofen because ibuprofen is to cause gastric irritation. Thereby, when prescribed with omeprazole, we have to reduce the gastric irritation which is due to the ibuprofen. What are the drugs that should not be used with ibuprofen? We have other NSAID drugs like diclofenac, aspirin. Diclofenac and aspirin, they are in the same classes with ibuprofen. When uses with ibuprofen, there's high risk of bleeding. And we also have anticoagulant drug. Anticoagulant is a drug that is used to coagulate blood, especially during injuries and other problems. And we have like warfarin, rivaroxaban, and heparin. These all these drugs should not be what should not be combined with ibuprofen, and we also have corticosteroid drugs like prednisolone, dexamethasone. They should not be prescribed. They should not be used together with ibuprofen. We also have blood pressure drugs like enalapril, furosemide. They should all these hypertensive drugs should not be used with ibuprofen because there's high risk that it can affect blood pressure drug. And we also have methotrexate drug, which is drug used for cancer. And we also have alcohol. Alcohol is one of the most commonly drinks that is being used by a lot of people, being drinks by a lot of people, and there's high risk of causing high risk of increasing in GIT bleeding. Research studies being published by National Academy of Science in 2018, they carry out the analysis of effect of ibuprofen on men. They found out that men who took high doses of ibuprofen of 1,200 milligram per day continuously for several weeks, those people have a chance of developing a condition called compensated hypogonadism. Compensated hypogonadism is whereby the testosterone in our body is stressed and is able to maintain the normal testosterone, because testosterone is the one responsible for the control of sex drive and also responsible for sperm production. And once there is a compensated hypogonadism occur, the testosterone is going to what? It's going to be prior. That means it will not maintain its normal production of what? Sperm. And we also have another research being carried out by a group of researchers, and they found out that ibuprofen there's high risk of causing cardiovascular condition, and thereby many people that have reported a lot of cases being reported from effect of ibuprofen. We have stroke. We have 49 cases has been reported on stroke, and also have thrombosis, which is clot in the blood vessels, and 157 cases has been reported on ibuprofen. We also have embolism. 9 cases have been reported on it. Hypertension, we also have 14 cases have been reported on effect of this ibuprofen. We have hypertensive emergency, we have 3. While tachycardia, that means abnormal increase in heart rate, we have almost 7 heartbeat, abnormal increase in heartbeat, almost 736 cases have been reported on tachycardia. And we also have myocardial infarction. That means myocardial infarction, 255 cases have been reported on ibuprofen. And we also have cardiac arrest. Almost 227 cases have been reported on cardiac arrest. And we also have heart failure. And almost 168 of cases have been reported on cardiac arrest, which is due to the ibuprofen. Ibuprofen is safe when it is used at normal dose. When it is used more than the recommended dose or the actual dose, is what cause all these adverse effects. And don't forget to, before you take any ibuprofen, make sure you take it after meal. Ibuprofen, if you are not sure about the dosage, about the dose, consult your healthcare professional or your pharmacist or doctors before taking ibuprofen. Thank you. If this video is helpful to you, like, share and comment.